Good afternoon, everyone, and thank you so much for joining us today for today's webinar, Self-Care During a Pandemic, presented by Dr. Lena Spracco. A couple of housekeeping items before we begin. In this platform, all attendees are muted, so while you won't be able to ask questions through audio, please do note the Q&A function on your screen so that if you have a question that's not addressed during the presentation, you can feel free to submit it there through the Q&A feature, and our presenter will try to address as many as possible at the end. Also, today's webinar is being recorded and will be posted on our website. As a registrant of today's session, you will receive an email link with a link to the recording once it's been posted. It's now my pleasure to introduce our presenter for this session. Dr. Lena Spracco is a naturopathic doctor and a licensed acupuncturist with University Hospitals Connor Integrative Health Network. She has extensive experience in a variety of clinical settings where she specializes in treating allergies, pain management, digestive disorders, and women's health issues. As a licensed naturopathic doctor working in the medical field for over 15 years, she's a clinically trained expert in health and wellness, integrating care with preventative measures and natural therapies. Dr. Spracco helps clients incorporate lifestyle techniques to optimize the mind, body, and spirit. In addition to practicing acupuncture, Dr. Spracco's interests include complementary natural-based therapies to support the body in correcting itself to heal. These natural therapies include herbal medicine, nutritional supplements, homeopathy, vitamin mineral therapy, mind-body therapies, and diet and lifestyle counseling. Dr. Spracco also holds classes designed to educate people on nutritional detoxification and on proper use of supplements. She's also a frequent lecturer on natural health topics in the community. So with all that being said, I'll turn it over to Dr. Spracco. Dr. Spracco, welcome and take it away.
Right. Well, thank you, Allison, for that warm welcome. And thank you, everyone, for taking the time out of your busy day to join us today. We will be discussing self-care strategies during a pandemic. Just a quick brief about me. I'm a licensed naturopathic doctor and acupuncturist here at Connor Integrative. I've been with the department for about 8 years now. And it's a wonderful place to work, and I'm going to be sharing all about what we do here during the presentation. So why don't we get started? So today's goals, I've written 3 of them down here to encourage you to take this moment in time to focus on improving your health through self-care, which you're going to hear me refer to self-care during this presentation as self-love, because this is really what we're doing as we are focusing on taking care of ourselves. Most of us do take care of others during the day, and we do need to fill our well with self-love so that we have enough to give back. So I'll be using that quite often. Secondly, hopefully we can empower you to follow a wellness-focused lifestyle, which we'll be talking about healthy nutrition, sleep, stress management, the importance of movement, and connection. And lastly, to educate you about the various practices that you can implement for daily self-care. Okay, our mission here at Connor is to heal, to teach, and discover. And that's the UH mission. And we also add in here at Connor that our mission is also to support you. So we really focus on supporting you throughout your healthcare journey and incorporating our modalities into your conventional medical treatment. Our vision here is to educate, evaluate, support, and transform the UH healthcare system by weaving our integrative health strategies into patient, employee, and community care. We can all achieve optimal wellness, and this is really regardless of the absence or presence of disease. Okay, so many of you may be asking, what is integrative health? We've been hearing this buzzword for the, past 10, 15 years or so, but it's really made its headway in the past, I would say, 5 years. So integrative health is defined as a blend of conventional medicine and complementary therapies. It's really the importance that we foster here to nurture the relationship between practitioner and patient. We focus on the whole person, and all of what we do here is evidence-based and has been backed by research. And one of the the focus is we make use of all appropriate therapeutic and lifestyle approaches by using many modalities and the different healthcare professionals that we have here in our department. And using all of this together, we weave a sort of an individual approach to your health and wellness with your conventional medical therapies. This is just a quick stat from the World Health Organization that about 50% of the population does use complementary and alternative medicine. So, it really tells you the importance that, the public and health providers have been placing on integrating therapies. Okay, so here our team, we do offer integrative pain management. So we provide non-pharmacological treatments for physical and emotional pain. So this would include acupuncture, expressive therapies, which is music and art, massage therapy, medical massage, I may add, meditation, mindfulness, and we do have physician services, including chiropractic, integrative medicine consultation, and osteopathic sports and movement rehabilitation. Okay, so here's our outline for today. First, I'll be discussing nutrition, sleep, stress management, movement, and connection. And then here to the right, I thought it was important, again, when we talk about self-care or self-love, that you love yourself enough to live a healthy lifestyle, because this really is how we're going to be able to move forward in our life, is taking care of ourselves and then moving forward to take care of our family, friends, and our community. Okay, so nutrition. This has been researched for many years, but recently we have known that traditional diets that are based on vegetables, fruits, meats, fish, whole grains, are associated with lower odds of depression and anxiety. So this Western diet of processed foods and fried foods, refined grains and sugar, these are all been associated with higher psychological distress. And lastly here, I thought this was very interesting. Some of the research shows that in just 10 days, a Mediterranean diet can improve your mood and condition. So the father of modern medicine, called Hippocrates, he did, put this quote out, and it's been known for many years. It's called, "Let food be thy medicine, and medicine be thy food." So first, we really should be focusing on our food as medicine, and medicine is your food. So let's talk a little bit more about that, okay? What do we mean when we say eat real whole foods, okay? So what I like to look at is what is not real, okay? Not real food is processed food, okay? So food that has not been processed to not look like its original form is considered processed food, okay? So here's a quote by Michael Pollan, a famous person who talks a lot about, ecology and diet and nutrition and what that all means when we put it together in relation to our health, is to eat food, not too much, and mostly plants. And the second quote I thought was really interesting. This is from Jack LaLanne, who he was out back in the 40s and 50s, even 60s. He said, if man made it, don't eat it. So basically, if man has processed it too much, you really don't want to eat it because it really lacks high quality nutrition. We also want to focus on a variety of colorful vegetables. So this will actually give us our antioxidants, which are anti-aging, and our nutrients. We also want to focus on fermented foods, which can be probiotics, which you can get in different foods such as yogurts, fermented vegetables, kimchi, which is sauerkraut, kombucha, and tempeh. Healthy fats are also really important for cognition, heart health, immune health. So that would include olive oil, fish oil, flax oil, coconut oil, and walnut oil. And lastly, I really do like to encourage people to eat with the seasons. So what this means is, now that summer is ending, we can take advantage of all those great fruits and vegetables that we still have available. And now as we move into fall, we're really going to focus more on, you know, squash and pumpkin and more apples and pears and whatnot. And this is what, you know, typical herd, you know, early humans used to do, is we would really eat with the seasons. And this way you're getting the variety of nutrients that are fresh, you know, right from the farm. Okay, let's delve a little bit more into what an anti-inflammatory diet would look like. So I categorize this here. On the left, you'll see eat more of, and on the right, you'll see eat less of. So on the foods on the left, you want to eat more of these because these will help to decrease inflammation. The foods on the right will promote or increase inflammation. So foods on the left to decrease inflammation will include wild-caught fish. Typically Pacific is preferred, and SMASH is a little acronym for sardines, mackerel, anchovies, salmon, and herring. Fresh fruits and vegetables, eggs that are organic and pasture raised, legumes, which are beans, raw unsalted nuts and seeds, unsaturated fats such as olive oil. I do add a little coconut oil in there. Even though it's a saturated oil, a small amount is healthy for you. Some herbs and spices are basil, oregano, thyme, turmeric, and ginger. So again, these foods here on the left, they contain more omega-3 fatty acids, which have shown to be anti-inflammatory. And as we move to the right, we want to eat less of conventionally raised meats, which means, you know, these meats have been, these animals, I should say, have been processed using antibiotics and hormones. So we really want to focus on eating more organic if you can. Decreasing, you know, some highly processed grains such as wheat, even dairy can cause a little bit of inflammation for some, corn and soy. Eating less, of course, processed white bread and sugar. And also some refined vegetable oils can also increase inflammation, such as canola, corn, and soybean. And lastly, when you're reading labels, when you're out in the grocery store, it's really important to look at the type of fats. So saturated fats, we typically want to eat less of. That would include trans fats or hydrogenated fats. And when you read your labels, you will see these listed there. So we want to decrease those. So again, these foods on the right, they'll contain more omega-6 fatty acids, which are pro-inflammatory, and we really want to make sure we're doing less of those in our diet compared to what we see on the left-hand side. Okay, let's move on. Let's talk about sleep. We all know the importance of sleep. Sleep is really paramount to good health. We spend about 1/3 of our lives sleeping, and most of us need about 6 to 8 hours. And as we get older, that number can, you know, go more towards 6 or even 5, and that might be good for some people. But for the most part, most of us need about 6 to 8. And as we go into these winter months, you may find that you may need more. So you may go up to 9, and that's quite all right. You just listen to your body. At night, we do make healing hormones. We make pain relieving hormones. So I can't stress enough how important it is to get good quality sleep, which means that it's easy for you to fall asleep and stay asleep. And this is how we can wake feeling refreshed and ready to tackle the day. So good sleep hygiene would mean that, you know, we have a consistent bedtime routine, kind of like you would see with children. So our body typically is, you know, wanting to go bed at the same time and wake up at the same time. So you might find if you're a little bit off, that your body kind of knows that, and it will wake up at certain times if we keep interrupting that consistent cycle. So making sure that you're decreasing any sort of stimulants, you know, at least 4 or 5 hours before bed, such as caffeine, alcohol. Making sure that you decrease blue light exposure, which means, you know, any sort of technology you want to stay away from at least an hour before bed, and really making sure that the lights in your house are dim to help stimulate your body's own melatonin production. So our body produces melatonin, which is a sleep-inducing hormone. When the sun goes down, the less light that's coming into our eyes will produce more melatonin. So if we're typically up and under bright lights, or we're, you know, watching bright TV, it's more difficult for our body to make melatonin. Our room does really need to be cool, quiet, and dark. So encouraging you to make sure the shades are down, and if you need to put a little mask over your face to help sleep, then we can do that as well. Some people definitely can wind down with a bath with Epsom salts to help relax your muscles, a little bit of lavender essential oil, reading a book, even meditation, and we'll talk about that as we move on in the presentation. And lastly, there are supplements that can aid in sleep. I do recommend that you speak with your practitioner before you start anything. There are many supplements that are healthy out there and are high quality. You can find melatonin, you can find, passion flower, kava. All of these things have been shown to be helpful. But again, please discuss this with your healthcare provider before you start, or do your own research. That's important. Okay, so here's a schematic here about stress management. So I like this because this sort of puts together some of the things that we offer here at our office and some of the things that you can do at home. If you need to take a day for yourself, I really encourage that. I typically like to take Fridays for myself to do something special, whether it's, an exercise routine or spending time with a friend or just putting on some music. Each one of these will speak to you in a different way, and let that happen. If you looked at this today and you saw, oh, meditation, that spoke to you, that might be something that you should, look into and try. So let's move on to talk about meditation and mindfulness. So many of you have heard of meditation and mindfulness, and for those of you out there who know quite a little bit about it, that's great. You might learn something a little bit extra today. For those of you who are new to it, let's talk about what it is. Okay, so what is meditation and mindfulness? So it's really defined as certain techniques that have been proven to help elicit the body's relaxation response. It's this compilation or integration of your awareness of the thoughts that you have, the feelings and the senses that you have in your body, and being aware of this or mindful without judging yourself, okay? And this is also where that self-love comes in, because we do tend to be our own worst critic. So that's the real beauty about this meditation and mindfulness approach. We can do this by sitting and breathing, by even walking and breathing and being mindful of our body and our breathing. You can use guided imagery and visualizations, and really the benefits have been studied to show that these techniques really help to manage our emotion, improving our ability to adapt to stressful situations, even to help decrease anxiety and pain. Here at our office at Connor, we do offer many meditation mindfulness programs. You may have seen emails coming from the Connor Resilience Center that will list stress management classes, meditation, mindfulness. These are all free and they're offered virtually. We did have them, in person, but most of these right now during the pandemic are going to be offered virtually. You can find these on the UH4U digital web workplace page. And just so you know that on Mondays and Wednesdays, we do offer chair yoga between lunchtime. It's about 12:30 to 1. And on Tuesdays and Thursdays, we have guided meditation between, again, 12 and 2. So I do encourage you to try these. Even if you just sign up for one class, I encourage you to do that, as you will definitely get something out of each class. And even if you can't attend regularly, you will get benefit from just one class. Okay, so I'd like to walk you and talk you through a simple breathing technique that I utilize with my patients. I also use this from time to time. It's just a simple breathing technique that I have called 4 + 2 = 6. It's just a stress reliever that you can use during the day. You could also use this as a sleep aid at night to help you fall asleep and to help you stay asleep. The key is to remember it while you're in that kind of groggy state. You can practice this now. Usually you can close your eyes, which is helpful, but many times you can keep your eyes open if it's just during the day and you just want to, close the door in your office. So the technique starts with placing your tongue just gently on the roof of your mouth. The tip of the tongue is just placed behind the two front teeth. And what that does is allow your jaw to relax. And that basically tells your brain and body that you're going to go into parasympathetic relaxation mode. Okay, you want to keep your lips closed, and you're going to be inhaling and exhaling through your nose only. I also encourage you, when you're doing this, is to put your hands on your belly. This way you can be mindful of what's called belly breathing. So as you inhale, you will notice that your belly will extend a little bit, and that's normal. And as you exhale, the belly will release a little bit. So again, you can close your eyes, put your hands on your belly. You're going to inhale for 4 counts. Then you're going to hold for 2 counts. And then you're going to exhale out for 6 counts. So if any of you want to join me in on this, feel free to do that. So I'm just going to kind of use my fingers to count. And you'll see I'm going to start with placing my tongue on the roof of my mouth. My lips stay closed, and I'm breathing through my nose only. Okay, here we go. I'm going to hold that. And I'm going to release for 6. So that's great. So that's going to be 1 set, and you want to repeat this for 3 sets. And it typically only takes about a minute or 2, and you will start to notice that your heart rate changes, your breathing changes, and you become more relaxed. So I encourage you all to, try that today at some point, or even before you go to bed. And you can even teach it to your patients if you're practitioners. Okay, let's talk about movement. All right, so our bodies were made to move, okay? It's important that you do this every day. We all know the importance of exercise, but sometimes we sort of forget how important it is to do that movement and how it affects us physically, mentally, and emotionally. So you want to choose a movement that makes you happy. A lot of times people say, well, I'm not a runner, or I'm not a yogi, I can't twist and turn into certain positions. And really, we have to take that sort of judgment and take it out of our conventional thinking of habit. Anything that you do that moves your body is fantastic. You can walk, you can do jumping jacks, you can dance, anything that kind of speaks to you is something that you want to do. Definitely having a Fitbit does help. It does motivate you. And again, you can choose walking, hiking, swimming, biking, dancing, martial arts. Any of these are going to be very beneficial. Yoga, Tai Chi, and Qigong, these are more mind-body techniques. These are my preferable exercise routines, but anything that you can do is really going to benefit your mind, body, and your soul. So I chose this little research article because I thought it was very interesting. They did this research at a workplace office. The title was The Effectiveness of Physical Activity Interventions in Improving Well-Being Across Office-Based Workplace Settings. And this was a systemic review in the Cochrane Handbook. It was a compilation of 5 studies, which included 1,326 participants. So basically what they found at the end is that you can really improve your psychological well-being by participating in any form of physical activity. Now, they did yoga and walking, but it could be anything that you do during the day. It could be anything you did from 15 minutes to a half an hour. I really don't like to focus on the time for people because it's really not about the quantity, it's about the quality. And it's really about you having that motivation to go out and do it. That's really the important thing to focus on. Okay, let's talk about self-connection, connection to others, and nature. So many times I encourage my patients during the day to just take a quick walk, whether it's around your building, inside your building, even if it was for 5 minutes. that can be really helpful. And, you know, even resting, for some people, it's not moving, and that's okay. For some people, it's going into your office, closing the door, and just giving yourself 5 minutes to, you know, take a few deep breaths, or just to close your eyes. Other things that you can do to connect to yourself would be having a gratitude journal. I know throughout the years, this has been helpful for myself and many of my patients. It doesn't have to be anything, you know, too grandiose. It could just be writing down 3 words, or what I like to describe as 3 things or experiences that you are thankful for during your day. So it could be something like, I went to the grocery store and I smiled at the clerk, or somebody smiled at me. Or it could be an experience that you had while you were talking with somebody. Really, it's anything that you are grateful for the day. And, you know, I'll leave that up to you to think of different things. And connection to others. At this point in this pandemic, it's very important that we do this. A lot of us are feeling disconnected. Even doing a talk virtually feels a little bit disconnected to compared to when I'm out speaking with people in person. But it's really important that you know, extend yourself to different family members, friends, coworkers, if you feel comfortable. And if you don't, you know, we do have here at UH the EAP, or the Employee Assistance Program, which does give us, you know, free access to counselors that can really help us and maybe even guide us to other organizations or support groups at this time. You know, and lastly, being connected to nature can actually feel like you're connected to others. You know, because being outside in nature, we are outside with living, breathing, you know, beings, whether it's animals, you know, grass, trees, air. You know, really going outside can be very grounding. You know, and being exposed to sunlight is super important. You know, as the winter months come up, I feel like I want to go out there and get the last bit of sunshine I can before, you know, Mother Nature turns us into winter bears. So I encourage you all to get out in the sunlight and take advantage of that. So let's talk about sunshine. Vitamin D, you know, what's vitamin D? Why is it important? Vitamin D is a fat-soluble vitamin. We do call it the sunshine vitamin. And why do we call it that? Because as our skin gets exposed to sunlight, it does make vitamin D. We know the importance of vitamin D is, you know, important for our bones, for our immune system, and we know that it actually can have antiviral effects. So really getting outside for a few minutes can really help our energy and help us feel connected. For those of you who are sun sensitive, you can take a supplement. You know, make sure you're talking to your healthcare practitioner before you supplement with, you know, any high doses. A typical maintenance dose is 2,000 IUs a day, but, you know, for some people who need more, you can go up to, you know, 2,000 to 5,000 a day. Okay, here are some supportive, oh, I'm sorry, here, let me go back. Oh, I've got a glitch in my computer. Sorry about that, here we go. Okay, I did want to talk just for a few moments about supplements. This can be a very confusing topic for a lot of people because it can be overwhelming when you go into the vitamin section, you know, if you're a health food store or grocery store. There are specific nutrients and supplements that can help mood, specifically, you know, a good multivitamin mineral that contains a good amount of B6, magnesium, zinc, and L-theanine. L-theanine is extracted from green tea. It's an amino acid that has really been shown to help decrease stress. Some herbs that you can take in teas or in capsules include holy basil, lavender, St. John's wort, and lemon balm. Again, these have all been researched to help with stress, anxiety, and to help with mood. Please, again, talk with your healthcare practitioner if you are not sure. There are interactions between drugs and herbs and nutrients, so please be mindful of that. Okay, let's go on and talk about acupressure for self-care. So many of you may have heard of acupuncture, and that is where we use needles, but what is acupressure? You know, I added this to the talk because this is something that you can do at home. You can actually teach this to a partner to do on you if you would rather do that. But really, this is something for you to do at home for your own self-care. Okay, so what is acupressure? Acupressure is a stimulation of an acupuncture point on the body. The purpose is that when these points are stimulated with needles or with pressure, so with your hand or with some sort of object that can, you know, hold pressure, that this will cause changes in the body. This causes changes in the body in your immune system health, your nervous system health, so it affects the pain receptors, gastrointestinal health, and vascular health. So these pictures here just give you an idea of the channels or meridians that run back of the body and the front of the body. But of course, these channels and meridians, they run up the front, side, and back of the body. So let's talk a little bit more about how we can do this. It's really best to perform this at least once a day. And even if you can do this just a few times a week, it'll make a difference. And make it a time that is just for you. You know, anywhere from 5 to 15 minutes is sufficient. And what you want to do is you want to massage each point for 3 to 5 deep, slow breaths. You could actually use that 4 + 2 = 6 simple breathing technique that we did earlier. Or you could just think belly breathing, where you're inhaling and your belly is extending a little bit. Okay, the breathing technique again will shift your nervous system to the relaxing and healing parasympathetic mode, but again, it's not required. You know, even just by massaging the points and being aware of that will be helpful. Okay, the first point here is called yin tong. It's located between the eyebrows here. And you want to just take your thumb and just press right in between your eyebrows here. You could use your thumb or you can use your index finger. And what this does is we really use this during acupuncture and acupressure here to calm agitation and anxiety. If you have a headache in the front of the head, you can actually massage this as well. It can actually help if your eyes are feeling a little bit discomfort, whether it's, you know, blurry or, you know, you're feeling like eye strain from, you know, looking at your computer, your phone, or the TV. This is helpful for that. And also you can do this before you go to bed. You know, you may make some sort of routine up where you're, you know, you're pressing this point for a few minutes and maybe you do the belly breathing. And lastly, if you have any sinus pressure, this can help drain that as well. Okay, the second point here is called pericardium 6. And this point is located just above your wrist. And you can see here in the diagram, if you take your fingers here and you put your pinky here or your fourth finger here, right on that crease here, you'll find that your finger will kind of just fall right into these 2 tendons here. And what you want to do is press your thumb right into those 2 tendons. So 90%, 95% acupuncture points are found in what are called a depression, or an area where you could easily depress right into. So you'll find that as you're pressing into here, there are these 2 tendons. You might be able to see mine here. Your thumb will just fall right into there. Okay, so you know, you can massage in either direction. This really is helpful, again, the same as the point in between your eyebrows, for agitation, anxiety, also insomnia. The one indication or function that this is different from the other one is that if you have any sort of like tightness, or you feel like, you know, your breath is constricted a little bit, that this point is going to be helpful for, as well as any sort of like feeling here of like even nausea or vomiting. This is a really helpful point. Okay, the next point here is kidney 3. This is located in between your Achilles tendon on the inside of your foot here, and that inner ankle bone here. So your hand will fall right into that depression in between, again, the Achilles tendon and that inner ankle bone here. So this point is really helpful, again, for agitation and anxiety, but this one's also good for fatigue and can support any sort of back pain, ankle pain, or heel pain. And again, you're going to use that same idea of pressing and massaging for 3 to 5 breaths, or you can use that 4 + 2 is 6 belly breathing. Okay, next point here is called liver 3. This point is going to be right in between the 2 tendons. If you can see here on the chart, there's a tendon that goes from the big toe, and there's a tendon that goes from that second toe up. And if you can focus in on that person's thumb going right into the depression between those 2 tendons. So this point is really helpful for treating any sort of pain or stress, mood, and really we do use this point a lot for pain. And again, anytime you're going to be rotating, you can go clockwise, counterclockwise, whatever feels natural to you is going to be what you'll end up doing. Okay, all right, lastly, sorry about that. So today, just to summarize, thank you all for coming. I do want to, give you a good thumbs up and, pat yourself on the back for joining today. I know that your time is precious, and it's wonderful that you could join us. And if I could just encourage you to choose one modality today that spoke to you, that you thought, oh, maybe I want to try that, or maybe I've been meaning to schedule that appointment at Connor. I really encourage you to do that, and be gentle with yourself. Self-care is really, again, about self-love and forgiving yourself for saying, oh, I know I should do this or that. And anytime that we can be gentle with ourselves, we really are caring for ourselves, and your self-care is going to change. It's going to ebb and flow with change in your life and different situations. And, one day is not going to look the same as the next. And again, just, be gentle with yourself, and, congratulate yourself for any of the littlest achievements that you've made, and, celebrate you, and you will notice that as you bring that space back into the world, your family, your friends, your coworkers, that you're going to feel different when you do that. So just a few things about our department. We do offer 60-minute appointments with a physician or an advanced care practitioners. And again, our goal is really to provide a customized treatment plan in partnership and as a treatment team to help manage your health concerns. A lot of these will include lifestyle recommendations, the different modalities that we have here with the different various practitioners, including, stress management and mindfulness. If some of you are confused about where to start, if you're new, an integrative medicine appointment with our, integrative medicine practitioners, Dr. Kalber, Dr. Miller, that's a good place to start. And they are covered by insurance. And of course, we do have virtual appointments available. Okay, here are the different locations that we have, east and west. For those of you who don't know, and you can just call our number here. We do have a website, of course. And so that's going to conclude our presentation. So I'm going to turn it back over to our moderator, Allison, with any questions that you might have. I'm happy to answer anything that I can.
Yes, thank you, Dr. Spracco, so much for covering those very important topics. We've got a few questions to cover here. I'll try and keep them in categories based on the different topics you covered. So starting with diet, specifically the anti-inflammatory diet that you talked about. Is this a type of diet that could benefit anybody, or is it especially important for individuals with certain medical conditions?
Yes, good question. So it definitely is very specific to anybody who has any sort of inflammation in your body, whether it's arthritis, any inflammation, any condition that ends with itis means inflammation. So arthritis, um, colitis, anything that, shows up as inflammation in your body, this is going to be an extremely helpful diet. And even for those who are already practicing a healthy diet, incorporating any one of those food items is going to be beneficial in the long run. And it's very similar to the Mediterranean diet.
Thank you very much. Someone else was curious about incorporating beans into their diet, the benefits, and if it matters what kind they incorporate.
Okay. If you don't incorporate beans right now, I will say that anytime you quickly or, introduce something that you haven't had in your diet, it might take some time for your body to get used to it, especially with beans, because they do tend to cause, bloating or gas, especially like kidney beans for some people. But I suggest typically starting with the smaller beans like lentils. You can find those in pink, yellow, brown, green. Because they are smaller, they tend to be a little bit more easily digested. But all legumes have been shown to be really helpful for inflammation, and for vegetarians, this is a really good source of protein for those individuals.
Very good. Shifting over into supplements, someone shared in the chat that they find apple cider vinegar to be good for blood sugar level. Do you have any comments on incorporating apple cider vinegar?
So I haven't seen that in the research with apple cider vinegar and lowering blood sugar. I won't say that it's not possible. Apple cider vinegar, especially if it's raw and organic with the mother in it, which means it has the bacteria or the fermentation that you might see on the bottom. That's really been helpful for a lot of patients if they have any sort of like reflux or any sort of digestive difficulty after you eat. Sometimes taking a little bit of apple cider vinegar, like a teaspoon or in a little bit of water, can help that sort of like uncomfortable feeling after you eat. For some people, they swear by it. They say that it gives them more energy, and more power to you. It's not a bad thing. Unless you have an ulcer, then that's not going to be a good thing. It's going to cause some burning. Yeah.
Okay, very interesting. Also on the topic of supplements, specifically herbs, someone is curious about herbs that they can take in the form of tea.
Okay. So I did mention that there are some herbs that are specific to mood, helping with stress, anxiety, or just helping you to relax. Not sure exactly the question, but you can find these herbs in single preparations, but you can also find them in formulas. You may see it on the shelf as, mood reliever or stress reliever or, relaxation formula or something along those lines. But if you're not used to drinking teas, I usually recommend trying something single by itself, like for example, chamomile, trying that just by itself, or passion flower just by itself. And then if you find that you do okay with that, finding a formula that has 4 or 5 different herbs in it. Teas tend to be really safe for people. Some people who have environmental allergies do have reactions with, for instance, chamomile, because they do run in the same family as those allergens. So you want to make sure that you're mindful of that. Yeah. And of course, not drinking too much before you go to bed, because you don't want to have to wake up at night.
Of course. Very good. Another supplement question, someone caught on to the mention of St. John's wort and is wondering about, I hope I don't pronounce this incorrectly, ashwagandha for stress relief.
Yes. So, okay, what's the question again?
It says, you mentioned St. John's wort. What about ashwagandha for stress relief?
Okay, yes, ashwagandha. Ashwagandha is an herb from the East. It's from typically India. and it has been used as what we call an adaptogen. So an adaptogen is an herb that helps us adapt to stressful situations. And so it's typically used in different formulas for that. Has also been used for helping with sleep. So you might see that formula, not that it's going to induce sleep, something like a passion flower or valerian, that's going to be more toward bedtime. But an ashwagandha can be something that you can actually take during the day. It could be in a formula, in a tea, or in a capsule for some people to help give you energy, and can help kind of relax you. So it kind of has two functions, and that's kind of what adaptogens do. They adapt to what your body needs. It's the beauty of herbs.
Fantastic. A couple more diet related questions. Someone is curious about the Ayurvedic diet, if it's something that you would recommend or discuss with patients.
Okay, so I am not an Ayurvedic practitioner. That is a specific training. I do have some education in Ayurvedic diet. They do offer specific benefit for people. You kind of have to be motivated to change your diet. You really do have to have a motivation and a drive, because it's a lot of work to do that, and there is good benefit with Ayurveda. But again, you have to make sure that you're coming into it with an open mind, and you find somebody who has training in that. And unfortunately, we don't have anybody here, but there is stuff you can find online about that. And yeah, I mean, Ayurveda has been around for thousands of years, just like Chinese medicine have. So there is time tested, if you will, results with that. So.
Okay. Someone curious about making homemade smoothies with fresh fruits and veggies. Curious if homemade is preferable to anything store-bought when it comes to sugar content and things like that.
Okay, so maybe I can answer this two ways. So smoothies, I typically don't recommend smoothies that come in an already prepared container. Now, with that being said, that doesn't mean that there aren't some out there that are good for you. I have seen a couple out there, and it's probably 2 or 3 that are good, but most of them do have a lot of sugar in them. So I do recommend making your own smoothie. They do have some stores out there. I think it's called Pulp or Smoothie something. There's a couple stores out there that do make them fresh as you go into the store. You could choose what you want, and that is preferable. And when you're making any sort of smoothie, I always recommend having more vegetables than fruit. It should not have more fruit. It shouldn't be a fruit smoothie, because really that's going to spike your blood sugar, and create mood imbalances. So I usually suggest and encourage people to make their smoothies at home. Good quality protein, a good non-dairy milk, and more vegetables than fruits. But if you can't do that, a little bit of berries or a little, half banana or a little bit of, half an apple is fine. Yeah, I don't know if that answered the question, but
yeah, I think so. I think that's a good starting formula, because you can get so creative with smoothies. So that's wonderful. Let's see, back to supplements. Are there any supplements for concentration, anxiety and stress, and better sleep for teenagers?
That was a loaded question.
Okay.
The first one, are there any supplements for concentration? Well, I usually don't like to just recommend blindly without kind of knowing somebody's history, what the goal is. But I can't say there's specifically a supplement for concentration. There are supplements that have been shown in the elderly to help with, cognition, memory, even dementia. Gotukulo, Gotuko. Gotakula. So that is it's also an Eastern Asian herb, and that's usually for 50 plus. Usually when I'm talking about concentration for people, I focus on diet as the mainstay, making sure someone's taking a good multivitamin, a good fish oil. That might be something to think about if you're not already taking a fish oil or eating fish, 3 to 4 times a week. Making sure you're getting a good fish oil in. That is really helpful because, our body does need fat. Our cells communicate on the outside between each other because we have fat on the outside of each of our cells. So that's how they communicate. So, if I had to choose one, I'd probably say a good multi and a good fish oil. Yeah.
Very good. And what about for anxiety or stress relief?
Mm-hmm. I usually go for teas first before I suggest any sort of single formula. And again, I really need to know the person's medical history before I'm suggesting something. But, a lot of stress relievers out there will have, passion flower, kava kava, L-theanine, some of the ones you may have seen in that other slide there. Those have been researched to really help with stress and anxiety.
Fantastic. And this might be a good transition into the sleep category. Someone was curious about supplements for sleep, and I believe you did mention melatonin. Is there a particular dosage, or again, is that going to be something to talk to a provider about before you incorporate melatonin?
Well, when we're talking about adults, the typical dose could be anywhere from 1 to 3 milligrams of melatonin, and it could be titrated up to about 10 milligrams. Usually don't need to go that high. And we want to be mindful of interactions with medications because there are some interactions, especially if you're on an SSRI or, something for depression. And if you're talking about kids, you can go anywhere from 0.5 to 1 milligram for children. Yeah.
Okay, very good. We have a question about whether or not there might be any value to blue light lenses. You had talked about creating a good sleep environment, making sure it's dark. This person is struggling with sleep and curious if it would be.
Okay. Yeah, actually, we do have research on these blue light blocking glasses. You may see them being called amber glasses. And some people actually wear them at work. I've seen people who are on the computer all day and wear them at work. But most people are wearing them at home, as the night comes on, at 6 o'clock on, throwing on your glasses, while you're doing, your bedtime routine or even while you're watching TV. It's something that you can do that can actually help, increase that your natural melatonin production. Yeah.
Fantastic. I want to give those a try. Sounds worth the try. Another sleep question. If someone is struggling with sleep and has tried a lot of the things that you talked about already, at what point is it worth reaching out to a provider? If they've been struggling for a few weeks, or should it be more like a few months? When's a good time to reach out?
Okay. So if you've tried all of the, healthy sleep habits, where we're really being mindful of what we're doing before bedtime, food and drink, less exercise. If you've really done most of these things, including supplements, you may have tried some of these things before. And honestly, to talk about supplements, you may have been taking something and thought it wasn't working, but it's because the quality of the supplement was inadequate. Okay, so supplements are what I call a buyer beware market, meaning that most of the supplements out there aren't good quality. So you could have been taking something and thought, well, this isn't going to work, but it's really because it wasn't high quality, which means a lot of times we don't know what's in these supplement bottles because really anybody can make them and put them on the shelf. So I would encourage you to, either talk to your healthcare practitioner, find someone who's knowledgeable about supplements and try the various things out there. Give it a good week, maybe 2. And then if that isn't enough for you and you're getting less than, 5 hours of sleep, then it's probably time to call your primary care doctor and go in for an evaluation.
Right. Yeah. Very good. Okay. Time for just a couple more here. Any diet recommendations for someone with a lactose intolerance?
Okay. So besides the obvious, I guess, is taking dairy out of your diet. There are various products out there that they make without lactose in it. They make milks, they make, I think I've seen ice creams, but they've made, yogurts, kefirs. So kefir is a fermented milk product. It's like a yogurt, but it's a little bit more liquidy. It's got more probiotics in it. I think that may answer the question, other than just completely avoiding dairy and trying non-dairy alternatives like, the different milks, almond, rice, oat, flax. I've seen hazelnut, walnut, coconut, soy. Yeah.
Lots of good alternatives.
And some people who are lactose intolerant, they can do a different animal, meaning they could try goat, they could try sheep. So there's goat milk, goat yogurt, goat cheese, goat yogurt. I said goat yogurt, goat kefir. So that may be something to experiment with.
Interesting. Very good. This is kind of a big picture question, since the whole topic of the presentation is self-care. What are some recommendations for self-care when we are all so short on time?
That's a good question. When we're all so short on time, we realize that we all have a minute or two. Just like today, we joined this presentation, and it was important. So again, let's try and be gentle and forgive ourselves for X, Y, and Z that we think we have to do. Even if you wake up in the morning and you stretch for 2 minutes, that's something you did for yourself. Maybe the next day you stretch for 5 minutes, or you did your belly breathing for 2 minutes. Sometimes just doing something before we start our day and at the end of the day can really help us set the right mood and end it on a good note. And that could be anything we talked about today, writing down in your gratitude journal, 3 things that you were happy about, or you made someone happy, someone made you happy. That really only takes not even a minute to do. So, once we start doing these little things, we'll notice that, we're going to feel different afterwards. And then we're going to want to incorporate a few more things into our self-care, because it feels good.
Absolutely.
Yeah.
Well, I know for sure that this presentation is going in my gratitude journal for today. So I just want to thank you once again for your time, Dr. Spracco. Thank you for sharing this information and for answering all our great audience questions. So just a reminder for all our attendees before we go is that we will email a link for them to be able to review this session on the website once the recording has been posted, and also that they can call to schedule an appointment with you or with another provider in the Connor Integrative Health Network by calling 216-245-5984. And I'll give that number one more time. It's 216-245-5984. And so that concludes today's session. Thank you so much, everyone, for attending, and have a great afternoon.
Okay. Thanks, everyone, for joining. Have a wonderful day.